and welcome. This is COVID-19 updates coming to you live from Mitv. I am Tommy Singh Ujo.
And I am Teresa Adeyemi. Good evening.
We start out tonight with the news from the local scene.
All right, the office, news on COVID-19 update from the local scene. The Office of Accountant General of the Federation, otherwise known as OAGF, on Friday in Abuja announced the successful restoration of service on the Government Integrated Financial Management Information System platform. The Director, Information, Press and Public Relations at OAGF, Ensure Ogbubike, made the announcement through a statement issued in Abuja. GIFMIS is an IT-based system for budget management and accounting. It is meant to improve public expenditure management processes, enhance greater accountability and transparency across ministries and agencies. Mr. Ogbubike said the shutdown of the GIFMIS platform was caused by the fire outbreak at the Treasury House on Wednesday, which was successfully contained. And the Lagos State Commissioner for Health, Akin Abayomi, has announced the death of another COVID-19 patient on Saturday. The patient died in a private hospital in Lagos after suffering from COVID-19 complications, the Commissioner announced. The details of the death was not disclosed by the Commissioner. This brings the total deaths from coronavirus in the state to 4. And Babajide Sanwo-Olu, the Lagos State Governor and the COVID-19 Incident Commander, said on Friday that the state has had 100% recovery from the COVID-19 cases from the cases admitted and managed at the Infectious Disease Hospital Yaba. As at Saturday, Lagos had 163 confirmed cases of coronavirus, 111 active cases, 46 recoveries, 2 evacuated cases, and 3 deaths. And still news from the local scene. A gatekeeper in Kaduna State has tested positive for coronavirus, the government has said. The unnamed man recently returned from Lagos State and has no connection to the first 5 confirmed cases of the virus in Kaduna. Amina Baloni, the Kaduna Commissioner for Health, said this in a statement on Saturday. And she said with the latest case, the number of confirmed cases in the state as of Friday was 6. The commissioner said that the latest case is a male who worked as a gateman in the Mando area and recently returned from Lagos. According to Mrs. Baloni, the 6th case traveled to Kaduna on public transport and made contact with the authorities. As the symptoms worsened, the patient has been evacuated to the State Infectious Disease Center. The commissioner warned that the latest case presents tonight. And that's all from the local scene. Thomas, what do you have from the global scene?
I'm starting out with this one from India.
Okay.
India actually starts their extends their lockdown.
Okay.
India's decided to extend a strict nationwide lockdown imposed last month to stop the spread of coronavirus, the top official says.
Okay.
And on Saturday, Prime Minister Narendra Modi held a video conference with state ministers, and many of them urged the government to prolong the measure. Delhi Chief Minister said Modi had agreed to extend the lockdown due to the end on Wednesday without giving details. There are concerns about how that curbs the affecting the poor and the economy. The spread of the virus has varied in India, with some states seeing bigger jumps in cases despite the shutdown. Millions of migrant workers have been left jobless, with the poorest suffering the most. India currently has confirmed 7,600 infections, 249 deaths, according to a tally by US-based Johns Hopkins University, which is tracking the disease globally. The true figures, however, are thought to be far higher. And this one from Great Britain, the health service staff still do not have the protective equipment they need to treat coronavirus patients, medics have said. The British Medical Association said doctors were putting their lives at risk by working without adequate protection. It comes as the health secretary said 19 NHS workers have died with coronavirus since the outbreak began. On Friday, Matt Hancock said there was enough kit for everyone and unveiled a plan for addressing shortages. The UK recorded 980 hospital deaths on Thursday, bringing the total to 8,900 258. That death toll, which does not include those who died in care homes or the community, has exceeded the worst daily figures seen in Italy and Spain. But according to England's Deputy Chief Medical Officer Jonathan Van Tam, it is still impossible to say we have peaked. Meanwhile, the United States has become the first country to report more than 2,000 coronavirus deaths in a single day, marking a grim milestone as huge swaths of the globe celebrated the Easter holiday weekend under lockdown from home. The global death toll from the virus surged past 103,000, with the United States quickly becoming the epicenter of the pandemic that first emerged in China late last year. Europe has so far shouldered the majority of all deaths and infections, though there were signs of hope the curve could be starting to flatten in some of the hardest hit countries. Numbers out of Spain offered a shred of hope Saturday. 510 new deaths, a dip in fatalities for the third day in a row. And France reported nearly 1,000 new deaths Friday, but confirmed a drop in the number of intensive care patients for a second day running. That's it on the news on COVID-19 updates. We now take some global updates. I'm starting out with this one from the world. At 16:42 GMT, that's about 4:42 Nigerian time, we have 1,735 1 million, pardon me, I take that again, 1,735,719 cases globally, confirmed coronavirus cases globally. Deaths now stand at 106,558, as we have recovered number of patients totally now stand at 392,901. A quick recovery breakdown right there. 50%, 4%, 50,172 are in serious and critical condition, while we have 1,186,086 in mild condition. That comes to 96% are in mild condition, and 4% of that are in serious and severe condition. We also have numbers across the world. United States has jumped to 508,126. Spain has also jumped to 161,852. Italy still stands at 152,271. Germany 123,826. France 124,869. UK 78,991. Iran now stands at 70,029. Turkey is 47,029. Belgium 28,018. Brazil 20,022. Portugal 15,987. South Korea 10,480. Chile 6,927. Japan 6,005. Denmark 5,996. We have Peru 5,897. Philippines 4,428. Saudi Arabia 4,033. Mexico 3,844. Dominican Republic 2,620. Greece 2,081. In Africa, Morocco 1,527. Egypt 1,794. South Africa 2,003. And I go to smaller countries like Cameroon now has 820 cases. We have the Diamond Princess 712. The Diamond Princess is actually a ship. And we have Tunisia 671. Cuba 620. Back in Africa, Niger Republic has 438. We have Nigeria has 305. Tessie, let's have some of the national updates from Nigeria.
All right, thank you, Tommy. Thank you, Tommy. See, on the 10th of April 2020, 17 new confirmed cases of COVID-19 were recorded in Nigeria. To date, we have 305 cases have been confirmed, 58 cases have been discharged, and 7 deaths have been recorded in Nigeria. The 17 new cases are reported from 7 states: Lagos 8, Katsina 3, FCT 2, Niger 1, Kaduna 1, Anambra 1, Ondo State 1. And you should know that the Multi-Sectoral National Emergency Operations Center, EOC, activated at least 3 at level 3 continues to coordinate the national response activities. And case summary in Nigeria as at April 10, 2020, we have total sample tested 5,000, total confirmed cases 305, discharge 58, deaths 7. And now to the states affected, we have Lagos. Number of cases confirmed in Lagos, we have 163. Number of cases on admission, we have 129. Number of discharge 46, and number of deaths 2, that is from Lagos. And now to Abuja, number of cases confirmed 56, number of cases on admission 41, number of discharge 7, number of deaths 2. And in Osun State, number of cases confirmed, we have 20, number of cases on admission 19, number of discharge 1, number of deaths 0. And in Edo State, number of cases confirmed, they have 12 cases confirmed, 9 cases on admission, and they have 0 discharge and 1 death. Now to Oyo State, number of cases confirmed 11, number of cases on admission 10, number of discharge 0, and number of death is 0. And now Ogun State, number of cases confirmed 7, number of cases on admission 5, number of discharge 2, and number of deaths 0. Bauchi State, number of cases confirmed in Bauchi is 6, number of cases on admission 3, number of discharge 0, number of deaths 0. Kaduna State, number of cases confirmed 6, number of cases on admission 5, number of discharge 0, number of deaths 0. In Akwa Ibom, number of confirmed cases 5, number of cases on admission 5, number of discharge 0, number of deaths 0. And now to Katsina State, where they have 4 confirmed cases, 3 cases on admission, 0 discharge and 0 death. And now to Niger, to Benue State, to Ondo State, where they have number of cases confirmed 2, number of cases on admission 2, number of discharge 0, and number of death 0. In Delta State, number of cases confirmed 2, number of cases in admission 1, and number of deaths 0, number of discharge 0. Benue State, number of cases confirmed cases 1, and number of cases on admission 1, number of discharge 0, number of deaths 0. To Anambra State, number of cases confirmed 1 case confirmed, 1 case on admission, 0 discharge and 0 death. Now the total confirmed cases we have in Nigeria is 305 cases, and number of cases on admission 1,240, number of discharge 58 in Nigeria, and we have 7 deaths in Nigeria.
You know, one interesting thing about Lagos and the response that we've had so far in Nigeria, the one that really strikes me as being very peculiar is the fact that we have almost a minute-by-minute update on the Twitter handle of both the NCDC and the Lagos State government. And glad again to inform us that once again, Lagos State government has posted another one here. They've discharged 4 new patients. And of this 4, you know why I'm glad? One of them is an 11-year-old. Wow. You remember that last week they had a woman and a baby. Was earlier reported that there was a woman and a baby that reported from the US, and both of them were discharged last week. Another child has been discharged now. He's an 11-year-old.
11-year-old.
He's an 11-year-old boy.
That's a very good one. And we appreciate the Lagos State government, the NCDC, every health workers doing this. We appreciate them. They really just keep up the good fight.
Exactly.
They are doing their best. We need to give honor to whom honor is due to. I'm telling you, and I believe this is due to them.
This is really due to them. Lagos State promises that they will take care of the health workers, and they say thank you for being ready, hardworking, and passionate about this fight against COVID-19. They really appreciate every single one of them. And I see the interesting picture on the on the Twitter handle of the governor of Lagos today. It's a very interesting one. I'm sure you can see that.
Okay.
But, for those people who want to see, you can just go to the Twitter handle of Lagos State government, or you can get to see that picture there of the workers at the isolation center. They all stepped out and they all took a picture with social distance in this kind of space. It's very important that it's time.
I believe they love what they do.
Yes, they do. It's a passion.
It's a passion. It's not all about the money.
In the face of death.
In the face of death.
You must really have passion for what you do, for you to continue to do it. And that's why it was very important for the NHS in the UK to have announced that particular news, that they have lost a number of health workers. The actual number is 19 health workers.
19 health workers from the UK?
To coronavirus.
To coronavirus.
Just
Are they Nigerians? We have Nigerians among them.
Yes, some of them are Nigerians.
Some of them are Nigerians. I saw some pictures. Some pictures was released on social media last few days. Nigerians that lost their lives in the fight against COVID-19. May their perfect soul rest in peace.
The Nigerian Diaspora Commission did celebrate in death those who lost their lives to COVID-19 across the world, and they tweeted on their Twitter handle over the weekend, on Thursday to be precise, celebrating those people. We also commiserate with their families and do advise every other person out there, please stay home and stay safe. We'll take this quick break. When we come back, we're looking at some new happenings in Lagos. When we came in the afternoon, I was talking to you about some of the distribution, some of the relief materials. I talked about Ms. Sadiya Umar Farouk, who is the Minister of Humanitarian Affairs, Disaster Management and Social Development, who was in Lagos yesterday and Ogun yesterday, both days, both states, to give us that truckload of rice, those truckloads of rice, noodles and vegetable oil. Another local government today did about the same thing amongst the many local governments that are doing such. We'll take that after this break. COVID-19, popularly known as coronavirus, is now a global pandemic as the World Health Organization has officially declared it and is fast spreading. So, as individuals, we must take the following precautions. Wash your hands, often with soap and water, for at least 20 seconds, especially after blowing your nose, coughing or sneezing, going to the bathroom, and before eating or preparing food. Avoid touching your eyes, your nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. You can help stop COVID-19 if you observe anyone with cough, cold, fever, or all of the above signs, or a person who has recently traveled from an area with ongoing spread of COVID-19, please call the NCDC toll-free number for guardians. The number 080-097-0000, 080-097-0001, 080-097-0002, 080-097-0003, 080-097-0004, 080-097-0005, or 080-097-0006, 080-097-0007, 080-097-0008, 080-097-0010. Do not engage in self-medication. Stay home if you are ill, and collectively, let's prevent and stop.
All right, welcome back. It's the COVID-19 update with Tomisi and Tessie.
And we're talking about some of the relief materials that we've seen distributed. You know, when it comes to news, one of the reasons why we do this is because we want to give you updated information as to what is happening in your environment. You report to us, we report back to you and let you know what we have seen. Now, a lot of accusations have gone around, Tessie, and they've said, they're not distributing
People are saying a lot of things, a lot of hot things, a lot of absurd things, that they're not distributing things. Actually, I think all through some few days back, like they weren't doing anything distributing as well. I think it was
some people were
doing, but it wasn't
some
enough.
Some were distributing.
Some were distributing.
But the news was general, as if nothing was being done.
Nothing was happening. You know, so when they talk about palliative measure, people kept saying they asked us to stay at home. What are they giving us? How are we going to feed our families? How are we going to eat? So that is why we've taken our own time to go and do our own survey. Because there's a saying, is believing. So you don't just call me and tell me this is happening, you're not getting this, you're not getting this, you're not getting this. No.
Now, it's not even meant for everybody, you know?
It's not meant for everybody. It is not just for the vulnerable ones. And who are the vulnerable ones?
And it's amazing to see that some people really think that they shouldn't be divided along the lines of whether you're vulnerable or
not vulnerable
or not. Now, I think that when something is about to be given to you, if you know that the person next to you needs it better than you do, or needs it much more than you do,
even if you can give it to the person.
Why would you want to collect and give?
Why would you want to collect? Yeah.
Now,
that is the mentality. That is
my right. I just have to go get it.
You understand? Even if you have, for those who have, don't get it, and if you are opportune to give it to your neighbor who doesn't have enough. You know.
But anyway, we have this video, and you get to see what exactly we saw at Bariga local government today, where some of the palliatives were being distributed to residents of that axis. You get to see Tessie was there live, so she gives us all the detailed information. I just watched it, and I think it was a beautiful one.
But it's a beautiful one. It was a beautiful one. Before I go ahead, I would really like to appreciate the chairman, Honorable Kolade Alabi. I'm telling you, he went out of his way. He was even distributing it himself. I was so amazed.
It was physically there.
Yes, it was physically there. He was present. He spoke to the people.
Now, this is not fabricated. This is something we saw. People
this is real.
Came there,
you can see the chairman.
And people collected. This was not distributed along party lines or political affiliation.
No.
This was just, I'm in the middle of the street. You just can't line up and get.
You know, even he had to listen. He had to listen to the complaint of the people, because, you know, some leaders were holding these things. They weren't ready to release them. And, you know, some youths walked up to him and said, "Sir, this is what is happening." And, you know, he had to turn back. In fact, we did U-turn many times. By the time we feel we're going, you just see him, he gets up, just get off from the car, and he says he needs to go there, he needs to see something that is happening. And there is this particular community in Bariga, it's called Agoigu. Oh, Thomas, I'm telling you, when they talk about the vulnerables, I think I now understand the meaning.
When I was talking about areas yesterday,
I'm telling you, this is a real slum. I'm telling you. When they talk about the vulnerable ones out, they say, you know, actually, all the palliative measures we've been seeing from other local government chairmen, they've all been trying. I must appreciate all of them. But I would like to appreciate Honorable Alabi more, because he packaged beans, rice, and gari, and cartons of noodles. You understand? He gave it to the people. But one thing I want the people to know is that he can't feed the old people living in that area. Like, according to the statistics, they said he had about 680,000 people in that area. Wow. So now, Tommy, just look at it.
That's a huge number.
Huge number, 680,000 people.
But looking at this quantity of beans, Tessie, I'm looking at this quantity of beans, and I say that this quantity will feed a family for over a week.
And this is not a case whereby one is for a building. No. You come out, you get your own. One is for...
Because that was the accusation.
That was the accusation we were getting, that a bag for a whole house. No, this is not like that. To a
CDA.
One bag to one CDA. But this is something different. And it was shared, it was given to the leaders, to go the youth leaders, the women leaders, the councillors. They were all there to collect and take it to their own CDAs to go and share. And in this situation, in this case again, this was not as if he's given one bag of gari to a whole compound. He didn't do that to a whole building. Rather, what he did was, okay, you come out, you get your own. But when we got to the slum, there was this slum we went to, Go Eagle. You see, that is where they are packaging it, a very neat place with neat people. You know, oftentimes you look at, okay, this gari that I want to drink, this gari I want to do, who are the people in charge of it? Are they even cleaning up? Is there social distance? I'm telling you, everything was highly maintained here. Everything was in order. I must give it to him.
Did the people, was there a crowd? Was it rowdy?
You know, in a case whereby you want to share something like this, you should expect crowd. I'm telling you, it was rowdy, very, very rowdy. Hey, Mr. Shayi, shout out to you. It was very rowdy, you understand. So, but You know, that is one thing I kept saying. People say they are not giving us food, they are not giving us food. I want to tell everyone who is opportune to watch, or if you're watching, you can tell someone. Whenever they come to your area, why don't you people just take it easy on yourself? It's going to get to you. He promised every one of them. He told them.
Get something.
You know what he said? He said this is a continuum. He said it's not stopping. That is what he's doing. It's not as if he's going to give them rice and beans today, that he is going to wait for another 7 days or another 1 week, or because there's going to be, we are not sure of another 7 days lockdown, and he's going to wait till then to go and serve them. But instead, this is a continuum. If you don't get today, it's not possible for all of you to get today.
But whatever it is you get
you get today, you get tomorrow, you get next tomorrow, you get the day after. Instead, it's going to do this until the lockdown is over. I'm telling you. That is what it said.
Now, you see, one interesting thing about this is that I saw this big pack of beans today.
Okay.
I was in the market earlier today to do a short review of what is happening in the market space.
In the market.
And, you know, it caught my attention that a pint of beans cost about 1,500.
You see what we're talking about?
And a pint of rice costs 2,000 naira.
Are you telling me?
And a pint of gari costs 1,200.
Imagine. So now let's do the mathematics.
So I looked at it critically, and I had to say that this is not a matter of
product being
scarce.
That is the slum.
Now, this is the proper slum.
This is the proper slum. This is Agoigo. You know, actually, when we were going there, I asked him, I said, must you go? He said, no, he needs to talk to the people. He needs to see them. They are his own people. You know, I'm telling you. He said he needs to see them. He needs to talk to them. They are his own people. Let them see what is being shared. And he gave them rice. He gave them beans. He gave them gari. And he gave them I think there was a carton of oil. Carton of noodles. You understand? He gave the carton of noodles, and you see, when we got there, I was like, wow, these people really need this. Now, this is the definition of vulnerable people. I'm telling you, when they talk about vulnerable, now I understand the meaning.
Because if you actually do have a choice, you wouldn't live here.
You wouldn't live here, no. You would never.
So when they're saying vulnerable, you know, people find it difficult to understand. People say we are all vulnerable, regardless of what we do, or regardless of our status, our educational background.
And with residents of about 680,000 people, how do you expect him to feed everyone?
No, Bariga has always been, you know, that kind of place where you have a slum, you have developed parts of Bariga. And a lot of it. You'll be surprised. You know, it will be surprising to note that even in Ikeja, even in Okwebi, there are slums.
There are slums. I know everywhere. Most places in Lagos, they have their slums.
Exactly.
Even Agidingbi here. Do you know
that there are slums?
Yes, I'm telling you.
When people now say that they don't know where the vulnerable are, I'm saying, hello, really? There are places where you don't. Yes, we know that people across board, you may not earn salary, you may not be doing so much, you may be living in the middle of a city, and you really cannot boast of 500 naira daily income. I know that, but there are people's situation are much more worse.
I'm telling you.
There are people. I was leaving home last night when we were leaving the office after the news, the primetime news, and it was surprising to me that when I got to Bega, there were still people sitting at about that time of the night on the pavements.
Do you know they don't have where to sleep? They don't have where to sleep. They sleep there.
They were undressed.
They sleep there.
So I knew that this was not a case of somebody trying to rob. The person was actually poised to lie down, and I saw about 2 or 3 of them lying down on that pavement on the way to Bega. So it was quite surprising for me. So when I say vulnerable, I think we really recognize vulnerable. But let's listen to Honorable Kolade and see how he addressed these people today.
I mean, if it is not perfect today, of course, tomorrow, because our people will be on the field daily to ensure that this food gets to all these activities. And that's what we are doing here now. So what we have distributed now, we have distributed rice, indomie, to the people, and beans. What's the quantity you distributed? The quantity that we are doing right now, we are doing 7,000 to 7,000 households today, and this is the first phase of the exercise. So we are going to commence again tomorrow with additional 5,000, and it's going to be continuous.
All right, sir. The food, please, sir. The food being distributed.
Wait, somebody asked when we are taking this ticket, which one is taking yesterday? It's not a public holiday. It's just a way of us containing this deadly disease by asking them to stay at home. Now, if we come without distributing tickets to our people, it will be more rowdier than what we are witnessing today. So what we have done is that yesterday we asked our people to go to all areas that we are going to distribute this to issue tickets to them. Then for those that ticket has not reached, we are also going to do that. And you can see now today that we are also giving to those without tickets. So, it's just a mechanism to maintain this social distancing. That's why we introduced this ticketing issue.
Now,
And again, yes,
isn't this strenuous?
All right, Tessie. That was Honorable Kolade, and almost dare say that you did a good job with that particular one. And
I want to quickly say something. It wasn't easy controlling the crowd. Because
I had to ask that question.
You keep defining social distancing, and they keep telling you, Madam, stay somewhere. We want to collect beans, we want to collect Gary, but I understand their plight, though. And most of them don't believe.
Well, the COVID-19 exists.
They don't believe in COVID-19. They don't
COVID-19 is real, people.
It's real.
COVID-19 is real, people.
It's real.
And brings us to the situation report of COVID-19 lockdown here in Lagos. You could see the crowd from that video. Yes, some of them did not practice social distancing. Some of them didn't even understand social distancing. And so we must talk about the reason why it is important for you to observe at all costs social distancing when you are having that walk on the road, when you are in the middle of the market.
Wherever you are, keep your distance.
First of all, you're not meant to go out.
You're not meant to go out
for markets
to get the essentials,
or maybe in a situation where something is being distributed in your area.
In your area.
Because that was what happened today. They almost destroyed my phone.
You can't control them. You can't control them. Even if you're not careful, they're going to push you away. You can't control them.
I saw something today. They almost destroyed my phone. And I was trying to take a video. A particular individual or church was distributing this special carton of noodles. And they wanted to give it to the people. So I drove past them. I saw it and I said, okay, let me park, and take a view of it. My God. The crowd, 200 women were pressing each other.
It's not easy.
So much so that the person who wanted to give it to them,
you should give it to someone who will go out and share something, because you're even sharing it, you're not safe.
You're not safe.
You're not safe. If you know the rules, you know what COVID-19 is, you want to keep your distance. But they don't know it. They don't even care. At that moment, they don't care. They want to get what you have to offer. Then after getting it, you can now tell them about social distancing. Then they're now ready to listen to you.
And I looked at it. The number of hands, somebody will carry the carton and pass to another person, So many hands have touched the carton by the time it finally gets to the person.
That's why I kept saying that
who wants to collect
COVID-19 should not enter the streets of Lagos. That should be our prayer. COVID-19 should not
Community transmission is what we must discourage at all costs.
At all costs.
It doesn't matter how long we have to be in lockdown. Yes, people are going to have my head for saying that, but the truth is we must prevent community transmission of COVID-19 as much as possible. I mean, the United States has over 500,000 people
right now.
And confirmed cases. Their hospitals, almighty USA has their hospitals full, so much that the president had to bring the Navy, the naval hospital that is a ship, to berth in New York to attend to people who are not COVID-19 patients, so that they can empty the entire hospital of other cases and put only COVID-19 people in the hospital.
But let me say, this now brings me to this question. When do you think this is all going to be over? With the cases they have over there, and in Nigeria, it's increasing.
Don't forget that we're not allowing them to come in.
To latest news, latest update of COVID-19.
Exactly.
I'm hoping for a day whereby we will all wake up and they will tell us,
do you want no
update?
I want
I'm waiting for that day. That will wake up one day and they will tell us COVID-19 is no longer.
The number of cases are not increasing. And that's when you know you have picked and then you're going down. Right now, we're
That is the reason we need the lockdown. They should understand. If you don't understand why we need this lockdown, go and check the global records. go watch it. Watch international news as well.
And that's moreover why we give them the updates, so you know.
It keeps increasing. It's not decreasing, it's increasing. It keeps increasing. I just hope it's not going to wipe out the whole world, because this thing keeps increasing, and I'm so scared. You know, now they said, okay, but fine, we are doing well in Lagos.
Yes, treating it,
doing well, we're treating
it. That's the main purpose of the lockdown. So many people have been saying, oh, they prefer to go on the streets and go fight it out. COVID-19 is not something that you can see. Coronavirus is not, that strain of coronavirus is not something that you can see with the eyes, box with your hands, or maybe just sweep away with your broom.
Just like I saw on social media, a picture of coronavirus, and someone put it on the street, placed it on the street. I think it's a Photoshop picture.
Yes.
And the person asks, what about if coronavirus is visible to everyone on the street? Will you go out? Why don't we ask ourselves that question? Because you can see.
And that's a powerful question.
That's a powerful question. What about if it's visible? You see coronavirus on the street. Will you go out? Everyone will stay indoor. You know, Alausa here yesterday. Do you know what happened yesterday night? When I went out to do my survey yesterday night again. You saw what happened?
When people were being packed on the streets.
Where were they coming from? At that time, and they said there is lockdown in Lagos.
It was a question. It was another question I asked myself this morning. As I was stepping out of the house as early as 9 o'clock, I saw that the entire roads were busy. People were just everywhere. There was a lot of movement. By the time I was coming back, except for the place where they were distributing those relief materials, I think the entire place was silent.
Was silent.
I drove and I didn't meet a single vehicle. I didn't meet anybody on the road walking. When I was going, people had knapsacks, packs, dressed as if they were going somewhere. But as I was going, I heard the siren of the RS vehicle, the rapid response, passing by. So I knew they were patrolling. When I came back, about 2.5 hours later, the entire axis, Ikosi, was like a ghost town.
And because you know what they're doing today, once they arrest you, they tell you to go, they take your car from you. Because you can walk on the street. Some people, I know some people, I was talking to one woman yesterday night, out of the women that was, among the women that was, the women that was arrested yesterday night, and I asked her, Madam, where are you going to? Where are you going to and where are you coming from? She now said, I said, I'm a journalist, that's why I'm asking, I'm doing this survey. Oh, she said, okay. And see, I went to drop someone. I'm not going back home. And we're talking about COVID-19. No visitors. No visiting for now. Stay in your house. It's not as if you're going there to get rice. It's not as if you're going out to get what to eat.
We're not going to the market.
You're not going to the market. So what are you looking for at that hour? What are you looking for at that hour? So I was just like, okay, so madam, do they want to collect bribe from you? I want to know. The woman said, no. There's nothing like bribe, but they said all of them should go home like that. And you won't even believe it that some people came from island to mainland, and when you get their car from them, you collect their car from them. How do you expect them to go back? In fact, I love that punishment somehow. I'm sorry to say that. But maybe that will make them listen.
When we're still talking about COVID-19 lockdown, people have developed a coping mechanism for this. We came across this interesting picture. It's a chart between two people. If they can quickly put it on the screen there. This chart between these two people, just I sent that to you as well. And the person said, okay, so what are you doing right now? This man actually did tell the person, my wife and I are in our cars in our compound, pretending to be driving in traffic.
Okay.
Yes, we are okay. I mean, mentally okay. And yes, it's also not so, the little things. But when you're tired of staying indoor, what this husband and wife developed this time,
when you're idle,
downstairs,
you don't have anything doing. Like me, I'm so used to going out, coming in, going out, coming in.
And now you can do that all the time anyway.
I can do that all the time.
Even on our job, even on the job, you don't get to do that all the time.
No, so you now imagine, we as journalists, they ask us to stay indoor, not going out, not moving, not doing anything.
We're still trying.
We're trying.
Yes, we stayed in the studio all day yesterday, almost 18 hours.
18 hours.
We didn't die.
We didn't die. And at least I stayed in the studio for like 2 weeks, isolating myself. Like, okay, I
But you were in Bariga today.
I went to Bariga today, too. So what else?
Yes, in the course of the job, we do get to go out. But it was interesting to me. People develop coping mechanism for this. And this man said, you know what, I have a better idea. Why not ask your kids to pretend to gala in your compound, moving around your car.
To make it look real.
To make it...
to make it look real.
That's boredom. We're simply talking about coping with boredom.
I'm telling you. No, people are really trying, because have you seen the challenge on social media? Yes, that is it. That is it on the screen.
Yes, exactly.
Like my wife and I are in. It's funny though.
Yes, they're pretending to drive in traffic.
You know, life goes on. We need to stay alive. We need to stay mentally okay. If this is going to make if this is going to make you feel mentally all right, then it's a yes. It's a yeah for me.
And that's why we're talking about coping mechanism.
Coping mechanism. Have you seen the challenge on social media where they will do the side chick thing and the wife thing? You've seen it. And the other one I saw you doing the other day, told me, say you were guilty of that too. You did your own too.
It's called a coping mechanism.
Your own.
It's a coping mechanism. You look for something to occupy your time while if you're not cooking. One of the things we can recommend to you on the COVID-19 update on Mitv as we begin with custom is, if you're not a cooking person naturally, maybe you should try cooking. Yeah. If you're the man of the house and you usually do not cook, I think you should go with your wife to the kitchen and say, honey, could you teach me how to make a goosey soup, for example? One of the simplest soup ever to learn how to make, and learn how to do that. Take up the cooking for your family. Do breakfast for them. It will be fantastic.
You know, actually, when things become bad sometimes, if you look when the tunnel is so dark, if you look so close, so deep, there's always a light at the end of the tunnel.
Very true.
I'm telling you, it looks like a lockdown. Yes, it looks like a dot. You say this lockdown, some children are not used to their parents. Before
now
they
can see them.
Now they can see their parents, they can do a lot of things. A whole lot of things with their parents. Yeah. You understand?
You know, a woman who doesn't drop her kids at school, school bus picks them every day. So this time around, they had to ask and say, Mom, when are we going to school? You know, every day, they've been asking, Mom, when are we going to school? You know what she did? She devised this means of keeping the children busy every day, because they still wake up as early as possible, dress up for school.
Used to it.
So she makes sure they're dressed up for school. She puts them in her car and she says something like, okay, so I'm going to drop you when I finish. So they're in the car, in the compound, dressed for school. She plays some music for them on the radio. She's in the kitchen, peeping, looking at them while she's doing every other thing. And so after about 1 hour, they come and say, Mom, we've not had breakfast. So they quickly come in, they have breakfast, and somehow they forget about going to school. And that has been the system every morning. So you must develop a style, you must develop a coping mechanism for this lockdown period. Thereby, you won't be restless. I'm
telling you.
I believe those who go on the express
this season, if you're not careful, depression will set in.
Definitely.
You have to be very, very careful.
So you need to get yourself mentally alert as much as you
can. It's not enough to go to the major road jogging before you get yourself busy. There are a whole lot of things you can discover in your house.
I find out the rationale behind that.
Those people that have stores, they have garage in their house, I think this is the time to start bringing out what is not useful and dispose them. You can do that to keep yourself busy.
Very true.
I'm telling you, you can do that.
You can clean your house in batches. Disinfect your house. Disinfect your compound first. Clean the entire environment.
Disinfect them.
Clean your surfaces the next day. The third day, you can bring out all the leftover in the freezer and make sure you eat them first. Then you can, there are so much activity. Board games, if you have board games now at home, this is the time. Board games is a fantastic way to bond, you know, with your family. I talked about cooking earlier. I'm telling you that dancing is therapeutic.
Yes, I know. I do it.
I know you do. Oh, that's true. You do that a lot.
I do that. I still did it yesterday, and I'm still having some pains here, and I know that means it's working. I did it yesterday for like 1 hour. I was in the room with music, and I was just dancing.
Dancing is very, very therapeutic.
It's very, very good.
If you're the type of person that doesn't know how to shake your body or move your body,
just
like to stand in one place all the time or sit in a spot, or you just are fond of lying down on the bed at all times, this is the time for you to learn to dance and dance and dance and dance and dance alone, if that's what you have to do.
And I don't know how true this is as well.
Time like this.
I don't know how true this is with the electricity promise to be given to people for 2 months. Have you seen that? I don't know how true that is, though.
Yes, the electricity bill that would be free for 2 months. The federal government actually mentioned, or the discourse came forward and said that we're going to give free electricity to Nigerians for 2 months if government will come to, you know, an agreement with them. But there is an agreement that is still being worked on by government, and that is still underway. The government is still working on the agreement. There is still no sign that there is
free electricity for 2 months.
For now, that agreement has not been reached. So do not believe the news in the media for now saying it's still on a non-concluded, undecided matter. Yes, the federal government did propose to the discourse that they would like to have free electricity for Nigerians, but modalities have to be discussed with the discourse, and that has not been reached. No agreement has been reached. It's still totally undecided. Still the federal government's proposal, nothing has happened to that so far. So let's just keep talking about your coping mechanism, especially when there is no lights. You know, that's another reason why people jump to the, because I've just been thinking about they say, okay, like you said, let's assume that COVID-19
is visible.
Is visible and you can see it everywhere on the street. You would practically run home every time you come out. You will lock yourself in.
You will lock yourself in. Even if they give you an umbrella that this will cover you from this, you will not.
You will not.
The way we run away from rain. I'm telling you.
You know the way we run away from rain.
Even sun.
Except we find ourselves in the rain.
In the rain.
Without help. You know, we can't help it.
Being caught up in the rain.
When you're caught up, you really cannot help it. There are no shops for you to go to and all of that. You know, those ones are situation where you can't help yourself. But when you can help yourself, truthfully, why would you want to be in the rain? See COVID-19 as something like that. They say there is a hailstorm somewhere or there's a tsunami happening somewhere. You definitely won't want to go out. So what the rationale behind wanting to go to use the boulders in the middle of the expressway?
I want to tell you, stay home, stay safe. That is just stay home, stay safe.
Exactly. So you have to create activity, really.
And again,
some activity.
Tommy said, the Christians, we Christians, tomorrow is Easter Sunday.
How are we coping? How do you think we're going to cope?
I don't know. This is the first time in history. I don't know my own history in my own life that we Christians you understand. And even if I don't go to church on Sunday at times, sometimes I don't go to, not on Easter Sunday, you know. There's a celebration
synonymous with church.
With church on Easter Sunday. And again, you know, that's when we come together. Even Good Friday, we couldn't celebrate it together. But now we have the e-church. That is how I call it. We have e-church, so we have to stay indoor. You know, like when I woke up yesterday, I saw this rumor on social media, and people were calling me that, Tessie, you are a journalist, please confirm this news for us. We've been told that the lockdown have been uplifted, and they have to go out because it's stuff. I said, if you try it, I'm telling you, you're going to be arrested.
Yes, you will do some community service.
You're going to do some community service. That is what you do.
Strangely, the streets have been cleaner, Tessie. I think because people are staying indoors, the streets have been cleaner.
Very
the roads
clean.
are cleaner.
Lagos street now.
So,
I'm telling you, Lagos roads are so clean. So clean. You know, before we were reporting about community report, this place is dirty, this place is dirty. But I think maybe because of the more people they have now that are doing community service, maybe that's why we have cleaner roads.
No. I think because people will go on the road, and this time around, very few people go on the road. You know, in the usual way, people go on the road and they drink a sachet of water,
or the pet,
throw it on the floor. They drink a pet bottle, throw it on the floor. A can of drink, they throw it on the floor. And that's been the usual style, you know. That's been the usual style. So in this kind of a situation where they really cannot go out, that means when they drink their pet bottle, they keep it. So we have
cleaner roads now.
But let's celebrate the people in the picture. That's the picture of the health workers. What you see behind them is the isolation center here in Lagos. And that's the governor of Lagos State, Governor Babajide Sanwo-Olu, and the Commissioner for Health, Professor Akin Abayomi, in front of the health workers manning that center.
And that is the definition of social distancing. You can see it.
Exactly.
Because some people will ask you, what do you mean by social distancing? And you still
have social distancing.
That's social
distancing. A closer picture. If you can see one of the closer pictures, you see the gap between each of them.
And you can
see social distancing at its best. If you see that one of the president yesterday at the briefing, there were three of them, and there was a lot of gap. You know, a lot of gap right there. We're still looking at that picture from Governor Babajide Sanwo-Olu,
and you can see that they're so happy with what they do.
That's why we say it is sacrifice.
So happy to sacrifice.
We must celebrate the health workers in Lagos.
We need to celebrate them.
Fantastic job, and we appreciate you.
I want to say a big thank you to their families for letting them do it. Because if your family is not in support, I'm telling you, it's going to be difficult for them. So we need to appreciate their families as well for letting them come out.
Are they on isolation? You know, that's a question. Do they go home at all?
I don't think so. I don't think so.
We need to celebrate these people, and we on the COVID-19 update and the entire Mitv crew and management celebrate the health workers in Lagos, especially those manning the isolation center at Yaba. You guys are doing fantastic work, and we must say kudos to you, and hope that you keep keeping safe, even as you are in the forefront of
Take responsibility
against COVID-19. Tessie,
take responsibility. All right, I want to tell you, I want to leave you with this. You use of face masks. Make sure masks should be worn in combination with social distancing, hand washing, and sanitization, and cleaning of surfaces. I'm telling you. That is how you should. If you wear your mask, you're wearing a mask and you're not sanitizing your hands, you're not cleaning your hands, you're not washing your hands with soap, and not just any sanitizer, an alcohol-based sanitizer. Use it to always sanitize your hands in the situation whereby you are not where there, you don't have soap and water, you're outside, you've touched something, you've touched the surface, you're not sure how the surface is clean, you're not sure maybe the surface is clean, or you've touched someone. Just bring out your hand sanitizer and sanitize your hand. And when you get home, just scrub your hand with soap for like 20 seconds, wash it for like 20 seconds or 40 seconds with water and soap. And I'm telling you, with this, we can fight COVID-19 together. I am Teresa Adeyemi. See you again tomorrow.
All right, and as I close, there is this picture from the NCDC. The WhatsApp and the Telegram channels are live. Please do not send your query to Mitv. Send them to the NCDC. That's the number on the screen, and that's the Telegram handle on the screen. Contact them for all of your questions that relate to COVID-19, how it can be prevented, and what you can do as an individual. My name is Tomi Sejo. We'll see you again tomorrow morning, bright and early. Bye for now.